Thank you very much. Thanks for those kind words, and thanks to the Rotary for all that it's done through the years. And the one party you didn't give credit to when earlier when they were mentioning the article in the newspaper is yourselves, in terms of a lot of what's being accomplished by the coalition. Would not have been possible without the strong support and involvement of the Rotary, and really giving time, talent, and treasure to the cause, and it's been invaluable. So I'm going to run you through a little update. I had a chance to talk to some of you earlier while we were still gathering, and hopefully we'll leave time at the end should there be any questions that folks want to touch base on that I failed to cover. Unfortunately, this disease, as many know, has been highly politicized, and it's hard to, even the data is unreliable. And so the data, this is just the data that I look at every day. And so this is yesterday morning's assessment of, this is the conditions of the hospitals of the state of Virginia. And so within the hospitals of the state of Virginia, yesterday there were 908 Virginians hospitalized that either had COVID or had symptoms consistent with COVID or were awaiting a confirmatory test. And of those, 190 were in the ICUs in Virginia, with 104 on ventilators. And then the number of folks that have been discharged from hospitals in Virginia so far is this. And the reason I focus on this is because my world mostly is within the hospital. The way Valley Health is structured, our response to COVID has been to have the hospital process, the ambulatory process, and then they're married at a command center. And I've been overseeing the hospital process, Dr. Jeff Feitz seeing the community process, working together with a command center with Dr. Sabah and the rest of the executives here to kind of navigate our way through this journey over the past several months. This is data that can't be cooked, okay? This is what I say is heads in beds. It's reliable, and it's not subject to the political winds, and it gives you a good understanding of the impact. And the number 908 is on the way down very, very slowly. And so fortunately, from a significant acute impact, we are seeing some positive trends. Overall, I'll give you a little bit of contradictory information as we move forward. This is looking at folks, and this is just our data in terms of where we are. This is looking at individuals that are within the hospital and the health system with either already the diagnosis or what we call PUI, a person under investigation. So a person that's got the symptoms and waiting for the test. You can see back in May, we were having census of 90 people in the building, and overwhelmingly Winchester, with one or two in the system hospitals that either had COVID or were awaiting a test. And the impact of this is significant because one of the challenges was back in here, testing was only available initially through the state lab, and you'd have to wait up to a week, and then through some commercial labs, and you'd wait 5 days. And so for acutely ill people, that was very much adversely impacting their care, but it's also impacting the overall journey because of the fact that the PPE, the protective equipment, was being used for oftentimes 5-6 days on patients that really didn't need it once the negative test result came in. So we put a lot of emphasis early on in terms of building local testing capacity. And it not only helps the patient care, but it also helps the caregivers be able to know whether or not they're wearing the appropriate protection and de-escalate that and be better stewards of the resources as we move forward. So on this slide, this shows you in contrast just the folks with COVID-19. And so you can see, of the 90 or so, 40 plus had it. You can also see as we went up, and our first case was March 21st that actually was in the hospital. And then as we went up, then we came back down, and we've been in this little bit of a valley here, our low being earlier in September, and we've had a little bit of an upward climb here of hospitalized patients over the past few weeks. And we're typically running on an average day something that looks like this. This is this morning's snapshot. There's 15 COVID positive patients, one of whom's on a ventilator, and 2 folks awaiting a test. This is all of Valley Health's data in all our hospitals, but all but 2 of these patients are at Winchester. And the majority of the care of the sicker patient is going to take place at Winchester just because of the resources we have as opposed to those resources that may be present in another hospital. So this is this current footprint in the teens is where we've been for about a month. We were living in the lower teens, and we're kind of migrate up to the mid-teens in the past week or so. This is just to give you an idea of the testing. I talked about how we made an effort to get robust with our testing. These are tests done through Valley Health, and to date we've done about 38,000 with about 2,300 of those individuals popping up positive. Just to give you an oversight of a kind of a control group, that the positivity rate gets very complicated because it's a difficult data piece to interpret because you can affect the denominator with a lot of asymptomatic testing. But this is just our overall run to date. This is this is from the Virginia Department of Health, just to give you an idea of the impact. The state of Virginia is hovering around 4.5%, 5% in terms of positivity. This is the Lord Fairfax Health District, which I'm assuming you're all familiar with. That's essentially the Northern Shenandoah Valley area of Shenandoah County, Warren County, Frederick County, Clark County, Winchester City, and that same jurisdiction that Valley Health's footprint is, the coalition's footprint is, and the State Police Drug Task Force is. So we're fortunate to have all that same impact. We're at around a 3% positivity rate. We are, however, seeing an increase in the disease and the impact of the disease in the southern part of our region. So you're starting to see an increase in numbers in Shenandoah County and in Warren County, and an increase in outbreaks in healthcare facilities in the southern part of our region, which would be Warren County and Page County. The concern here relative to those outbreaks is that when you go back to what happened in March and how it came to our part of the valley, we got it from the Martinsburg area and from the Harrisonburg area. And you could just watch the numbers kind of come in on us in March and leading into April from those two areas. Where the MARC train ran out of DC is kind of where you started seeing your first cases in this region, in the panhandle of West Virginia. And then when some kids came back from spring break to Harrisonburg, where the first cases down in Rockingham County, and they seeded our community. And my concern currently is the adverse potential impact from the south that we're seeing as a result of the increase in the cases with Harrisonburg and JMU. Those kids go out, they're in the community, somebody stops at a sheet station and you pump gas and you don't practice good hand hygiene, you rub your eyes, and then you get back in your car and you bring more COVID back up into our area. So something we're watching very closely, and something that early indications are we're starting to see it come up more in our area as a result of that approach from the south. Again, our hospitalized impact in general has been relatively stable. We have, as was mentioned in the paper this weekend, currently an outbreak at Lincare in Warren County, an outbreak at Warren Memorial Hospital in their inpatient unit. I had the opportunity to visit there late last night to kind of see how things were going and make sure that we were heading in a good direction. I can assure you, last night at 10 p.m., things are going in the right direction. And then there's another skilled nursing facility in Warren County that also has an outbreak. And a lot of that is introduction through the workforce that goes to these same sheets that the kids may have been at, and just that whole seeding of the community coming up at us is a little bit disconcerting right now. This data is our mortality of patients within the hospitals. You can see Winchester's done exceptionally well with mortality. Our overall mortality early on ran around 12 to 14%, where the state average was around 24%, and the best published study out of the United Kingdom was around 30%. We developed a team that followed all our patients from day one. And so we had a 24/7 backdrop of clinicians, physicians and nurses that work with me that created a process and a database to monitor 100% of the patients from the moment they entered into our hospital system until they were home and safe. And through that, we developed a lot of data in terms of what predictors were of deterioration. And we created an electronic platform within our health record that would say, hey, this patient's COVID index score has exceeded this number. And then that triggers a series of escalations of care innovation. That process went live back in here, and you can see it's had a profound impact on decreasing the mortality. A lot of that impact is relative to getting the multi-drug therapy to the patient early and moving patients from regional hospitals into Winchester early. And it's been invaluable. It's currently being looked at by our electronic health company, Epic, to see how it marries up to some of the things they have. But this was something that Valley Health created on its own. Dr. Frank Lewis, who many of you may know, was instrumental in guiding this. We actually jokingly named it the Frank score and created a kind of a bizarre acronym to justify the name. It's something that we're proud of the work that the team did, and I think positively impacted the community's care. I'm going to kind of go over some additional harm that we've seen from COVID, which was alluded to earlier in some of your pre-meeting comments. And if you look at the shutdown of the economy and the shutdown of society essentially over all these months, there's been tremendous harm, a lot that we know about and a lot that we don't even know about. If you talk to individuals that work in the juvenile field and folks like John LaManna and his colleagues and all, There's been a tremendous decrease in reporting of child abuse and neglect because kids weren't in school, and so much that gets picked up in school that the social services seen a decrease in that. And it's not that it's not happening, it's just that we're not aware of it because the kids aren't coming into school and people aren't speaking up on behalf of the children. Another area has been suicide. We're fortunate here at Valley Health that we applied for and received a grant that's a sizable grant for the next 18 months to try driving the local suicide to zero because all around the country it's increased as well as our community. And so we'll be launching a care navigation process in the emergency room for patients at risk for suicide and a landing pad into the community for them. It's a federal grant for just around $750,000 that we just received that I think will have a very positive impact on yet another harm event, so to speak, that's taken place as a result of COVID. And then if you look at the overdose data that I believe Don was referring to earlier, as of the 23rd, we had in our region, that same geographic region I described, 44 deaths as a result of opioid overdoses, and that's that we know of. And this is compared to 23 at the same time a year ago. So you can see the tremendous adverse impact that we've had. And it actually goes back to, I've got another slide that's not in this presentation. Go back to March 23rd when the first case was publicly known in the Valley, which was a gentleman that was visiting Page County from Fairfax that ended up coming up here. This number has skyrocketed since that happened, and since everything shut down and so many resources were lost to individuals suffering from substance use disorder or misuse. And I'll talk a little bit more about that here shortly. Here's the non-fatal overdose information. So this is basically using Narcan administration. Again, an enormous increase, 100 a year ago, year to date, 149 now. And this underestimates the problem because this is Narcan that's administered that we know of typically by first responders or law enforcement. And there's so much more Narcan, fortunately, in the hands of private citizens and people with relatives or loved ones of folks that are challenged with substance use disorder, that those aren't even tallied in here. So just of the known, you see a tremendous increase. When you look at the overall issue around opioid use and misuse and deaths, you go back into the 90s, and the first one obviously was prescription opioids. That's been well established and well documented, and kind of the horrific story of some of the pharmaceutical industry and the distributors and physicians that were complicit in that. And then there's a second wave where we switched over from the prescription pills into the heroin, and again, an acceleration of deaths. And then synthetic opioids like fentanyl coming in from Mexico and China and making their way into our households in Winchester. And that, starting back in 2013, and currently we've seen for the past little over a year, and Tiffany, who's one of your members, can speak to it far better than I can with much more knowledge. You've seen an increase in polysubstance abuse, but use of stimulants, a lot of stimulant drug abuse. And you see it, and it exists on the prescription stimulant drug abuse. It exists on the illicit stimulant drug abuse, and it involves all members of society. There's our team that works in the emergency room with folks that come in, the soccer mom package basically that they describe is, the mom who all day long is using either Adderall or other stimulant drugs, and then at night misusing alcohol, and the cycle continues, and then eventually end up in the emergency room in a crisis. And so you see this stimulant drug prevalence in the community at an alarming rate. In terms of the social factors, the trauma and the adverse childhood experiences can't be overstated. And then a whole host of different events that have been exacerbated by COVID-19 have made things much worse for the community. A whole bunch of people losing their jobs, losing their support group and their connection, the need for connectivity for the individual in this disease is enormous. And when you strip that away because we have this adverse impact, that's a huge loss to individuals. And then there was a push for early release from incarceration to protect from COVID without having an established plan for individuals who are going to go back out and reuse. All these coupled together have led to an incredible adverse impact of this disease relative to all sorts of health and social issues, untreated diseases and all, but just relative to the fine work that the Rotary's done and to tie it all together with COVID, I think it's important that you know that it's had a profoundly adverse impact on our community and our loved ones that suffer from substance use disorder or misuse. So kind of stepping back and looking at the journey, you know, as I mentioned earlier, you know, the night of March 21st around 10 p.m., I got a phone call about this patient who presented a page that we needed to move up here, and came in, and about midnight or so, Dr. Bowder and I were all proud about how well everything had gone. And, you know, it's going tough all over the world, but man, we here at Valley Health, we crushed it. And quite frankly, had a completely misguided view of our confidence. We were unknowingly standing right in front of a big tidal wave coming at us, and that just grew and grew and grew. And we had to do a lot of adjusting on the fly and a lot of learning on the fly, and we did well, and we've learned a lot for the future. So if you look back at some of the challenges we had, the PPE was an issue in terms of getting enough. We fortunately, actually, this is a reprocessed mask, the Gear Clean here in Winchester. Folks drop them as they leave, and then they re-sanitize them. We've done all sorts of sterility testing. I've been wearing them since day one, these reprocessed masks, since we first got the first shipment, because if we ever do need to dip into this reserve, I want to be able to tell folks, listen, it's safe. I've been wearing it for 4 or 5 months, and I'm okay, and you're going to be okay. But I'm the only person actually using those. But we've had to preserve PPE. We've had to find alternative sources of PPE. We've had to reprocess PPE, all things we never had to do, nobody had to do. But there was this tremendous need, because our main focus has been we've kind of centered back on our mission as Valley Health, which is to improve the health of the community. And we've coupled that with protecting patients, so providing a safe environment of care for patients, protecting the staff, and protecting the community. And all our decisions fall into that and have guided the entire process. We had a need to secure the campus. The WMC building is 1 million square feet under roof. It's got over 60 entrances, and you couldn't have a free open place and create those and meet those requirements. So a huge increase in our security presence, locking of doors, security personnel, and responding to that, securing PPE. We've had to, our PPE storage facility is secured by armed former Navy SEALs. And the reason for that is that in other parts of the country, this has become a hot commodity. And there was a couple things in the West Coast, a couple places where they bumped off the PPE from healthcare facilities and then resold it elsewhere. We had several thousand masks and gowns stolen after they cleared customs in New York City. So we had a shipment that was supposed to have 70,000, and it got to Winchester and had 45,000, and never to be seen again. And so things that you didn't think of, you had to kind of react to, and these were challenges that we faced. We're fortunately very blessed with great physical environment in Winchester and clinical environment. Some of our other hospitals had to increase some of their resources a little bit. We did increase the number of ventilators we had. We never got anywhere near needing them, but we did proactively react to what we were seeing in Europe back in the late winter, early spring, and then in the Northeast. From our point, we were fortunate to build a lot on prior work we'd done. We'd done a lot of work as a system in coordinating movement of patients, and we were able to build on that and scale it to what we needed. And we couldn't communicate enough. And again, circling back to the principles here on the right-hand side of the screen of what's the mission of Valley Health and what are the principles that are guiding our care decisions, our resource allocation decisions, because we'd make decisions that may adversely impact part of the care team, and it may not make sense. And so we'd always have to circle back and say, well, this is how we got there. Do you understand how we got there? And make sure we engage folks in creating that framework for decision making. As we look forward, some of the challenges here, the resource stewardship, maintaining inpatient capacity. As our numbers go up, there's a whole host of other disease processes that need to be cared for. And so we need to be able to take care of our care team, keep them healthy, and be able to do all the other things that the healthcare system requires and meet community needs. As schools reopen, as the university comes back, and folks need to go back and see their doctors, all of these have been challenges over the past several months. When you start looking at the future, the vaccine is a tricky item. The approval of a vaccine historically is very complicated, and it's done differently than other medications. So the FDA approval process for other medications, the safety data goes directly to the FDA. as the drug trials going on. But for vaccines, historically and currently, it goes actually to the drug company and not to the FDA. And so the way it's set up is different than other drug approvals. It's something I'm just learning about. But there's potential risks with the vaccine in terms of vulnerability. So just a couple, and I'm not a vaccine expert, but just a couple things to think about. Many of you are familiar, they've gone like with the flu for proper patients, not for everybody. They use a nasal spray. And the reason is that it's a live vaccine in that setting. And what it's doing is conferring an immunity to being a carrier as well. So all these vaccines that are being developed currently will not make people immune from being a carrier. It'll make people immune from getting the disease, but they won't get what's called mucosal immunity. So there's the false assumption that you're not a carrier, and the risk thereof is not insignificant. And so that's one issue. And so the other issue is that a good vaccine covers about 75% of the potential illnesses. And that other 25% still remains significantly vulnerable. And masking is still required even for the vaccinated because of the fact they can still be a carrier. So as it rolls out, eventually we will have some vaccines. Some of the keys that you as Rotarians need to think about is how not everything, in medicine, I've always said, everything good was once new. Not everything new is necessarily good. And so you need to kind of wait and see a little bit of how people react to it as it goes more broadly distributed. And the fact that we can't get rid of all the other things we've been doing to help control this disease. So the wearing of the mask, the washing of hands, the watching of distance, that all will remain important even in light of a vaccine. So those are some of the challenges relative to the vaccine. Unfriendly players. To me, on a personal note, I can't imagine that individuals who are unfriendly to our country, other organizations or countries or terrorist organizations, aren't seeing the power of bioterrorism through this current pandemic. A virus has paralyzed the world's economy, disrupted the world's social structure, and one of my concerns is that viruses can be man-made. And are we ready as a community, as a country, to react to bioterrorism in light of this? I think we've learned a lot, but we still have other opportunities as we move forward. Those are sorts of things that I think about and stew about. The key to moving forward is what you've all been familiar with, is wearing masks, watching your distance, washing your hands. Last night I had to ride in a car with somebody who I work with every day. But you got to wear a mask when you're in a car with people if they're not in your immediate kind of COVID circle, because the car is a significant risk of sitting within 6 feet of one another for a prolonged period of time, and we see a lot of exposures that way. When in doubt, move it outside. You're going to the movies outside, and to see a great movie, by the way, is a great idea, as opposed to doing a movie theater. You're having friends for dinner, you're having family for dinner that you're not interacting with all the time. If possible, have it outside. Remember to have some hand sanitizer there so that everybody sanitizes their hands before they're grabbing any common utensils to serve. So there's basic things in terms of hygiene that you can do and that we can continue to do to continue to decrease the impact on the community relative to COVID. So I've kind of wrapped through a lot of information. I'm happy to take questions. I think somebody posted something on the chat here that I can read through. That's a great question. So it's kind of got multiple parts to it around children going back to school, and what impact has that had, and the runny nose deal. So in schools in general, many schools throughout the world have done quite well with in-person teaching, and I can tell you that there's been some good studies in other countries where they've actually had some kids show up with COVID. And in Europe, there's one study where a kid showed up with both COVID and the flu. A bunch of people got the flu, nobody got COVID from that kid. And so there's a pretty decent body of literature that if you bring kids back to school safely and smartly, you can do pretty well. The schools have to be well resourced. This is a subject that hits me a lot because my daughter works for the District of Columbia Public Schools, and they don't budget for soap. And so you can't bring back kids if you don't have a soap budget, and the whole hand hygiene bit. My sister works for a private school in Northern Virginia that has been back in school now for 6 weeks. K through 8, and nobody's gotten anything. And it's a lot of making sure the classrooms are spaced out, that the kids are washing their hands, teachers wash their hands. If a kid's sick, don't send them in. So then you get to the child who's got the cold, runny nose, seasonal allergies. That is going to become a very complex issue in that those kids are probably merit testing if they have those symptoms. We're about to, in the next week to 10 days, widely roll out rapid antigen testing. And so rapid antigen testing will be within a couple weeks available at all the urgent cares and all the Valley Health primary care practices in the Valley. And what that is it's a quick 15-minute test. If it's positive, you have COVID, okay? If it's negative, the unfortunate thing is it's got about a 15% false negative. So then it comes down to clinical suspicion as to whether or not you do a higher level confirmatory test. So I think as a community, and you see more kids going back in school and more of the community coming back to life, that symptomatic testing is going to be very important. Antigen tests, however, don't help with asymptomatic testing. It's only approved for symptomatic testing. So it's a little bit of a nuance, and we're working through how we're going to roll that out in a safe way for the community. All these things, again, the kid with asymptomatic COVID, there's asymptomatic carriers. And if you and I are together and you have COVID and you're wearing a mask, I'm wearing a mask, and I'm washing my hands, I'm not rubbing my eyes, I fall into the low risk exposure with that masking and hand hygiene and other protection. If you're unable to wear a mask and you have COVID and I'm just wearing a mask, I need to also wear eye protection. And so I think that in general, you can be around. I went last night to Warren, which is a COVID hotbed right now, and I wore my mask and I was perfectly comfortable doing that. And you're very, I grew up as a surgeon, and you're very mindful when you're scrubbed in surgery, you can't be rubbing your eyeball. And so you have to have that mindfulness of not touching your eyes, not touching your nose, and having that good hand hygiene coupled with a mask. And I think you can do an awful lot to create a safe environment for yourself and for others.